What is empathy? Feelings, ideology, politics? That's what it sounds like to me. The American heritage of lit
Unanimous
law.
consent that the quorum call be vitiated.
Without objection.
And, Mr. President, I ask unanimous consent to be able to speak until the top of the hour. The vote is scheduled.
Without objection.
Thank you, Mr. President. Mr. President, I come to the floor today, as I have over the past several years, to talk about issues that are affecting this country. I know there's a nomination that we're discussing on the floor, and I have concerns about the issues related to that nominee, the way that that nomination has been brought forward, because it was done by what I believe to be an abuse of power move in a way that resulted in voting in the middle of the night, discussions in the middle of the night, all, in my opinion, to distract from the disaster of the Obama health care law. The Obama health care law continues to affect people all across the country, and what we saw on October 1st in the great debacle of the rollout of the website was really just about a website, October 1st. But come January 1st, it's about real people who've lost their insurance who are going to be hurt personally in terms of their own health by this terrible law. So I come to the floor, as I have week after the law has been passed, to talk about the concerns that I've had as a doctor, someone who's practiced medicine in Wyoming for 24 years as an orthopedic surgeon, taking care of people from all around the state, and someone who, as a medical doctor, was the director of a program called the Wyoming Health Fairs, aimed at giving people low-cost blood screening, having health fairs that people can attend from around the state. They can check their blood results, visit with doctors and nurses and others in the community about issues of heart disease, diabetes, all aimed at preventing disease, early detection of problems, and lowering the cost of their care. So I had a great interest when this health care law was proposed and watching it unfold, and the concerns that I had as it was passed continue today. And I think more and more Americans are seeing that those concerns are being realized in their own lives. And this is what it's about, people's lives. So the website failures, to me, are just the tip of the iceberg. But what people are seeing now all across the country, Mr. President, are higher premiums, and there are stories rampant around the country. I still recall the President of the United States saying that by the end of his first term, insurance premiums would be down $2,500 per family. Instead, families are paying much, much more for health insurance. Concerns, obviously, the canceled coverage because folks around the country, over 5 million, I understand, by the recent counts, have received letters saying that they've lost their insurance. Their insurance has been canceled effective January 1st. The President promised if you like your doctor, you can keep your doctor, but now we're seeing that many, many people aren't able to keep their doctors. Even though they like their doctor, want to keep their doctor, they can't. Issues of fraud and identity theft that we're hearing on a daily basis. Chief of staff of one of the members of the Senate was applying on the Obama health care website, the government website, trying to get insurance just this Monday, and got to it looked like sure looked like the federal website. He thought he was on the federal website and putting information, and then it goes to a screen where they wanted to know his bank account number and his PIN number. He said, well, this can't be right. He called the helpline, spent over an hour, I understand, on the phone, and then they ultimately said, no, get off of that. It can't be. It can't be, though, the federal government website. Get off of it. So, but now he was, focused enough to think this can't be right, but the fraud is going to be rampant. We know that. Identity theft as well. And then we're seeing huge problems with higher co-pays and deductibles. So, Mr. President, I come to the floor and note that, and I have with me a couple of articles from this week's newspapers. Wednesday, Wall Street Journal has their recent poll numbers. Health law hurts President politically. The health law hurts President politically. The subheadline is, Disapproval Rate Obama's Job Performance Rises. The disapproval rate of the President's job performance now rises to an all-time high of 54%. 54% disapprove of the job that the President of the United States is doing, and it says even as Americans are upbeat on the economy. So it's not the economy that has people so disappointed and disapproving of the President. But let me just read a couple of paragraphs here, Mr. President, because This is about the President of the United States and what we would want in a President of the United States in terms of credibility with the American people. It said the federal health care law is becoming a heavier political burden for President Barack Obama and his party, despite increased confidence in the economy and the public's own generally upbeat sense of well-being, a new Wall Street Journal NBC News poll suggests. Now, we can go through how the whole poll is conducted, but people across the country believe the NBC Wall Street Journal poll is a true reflection of what's happening nationwide. It says disapproval of Mr. Obama's job performance has hit an all-time high in the poll of 54% amid the flawed rollout of the health law. Half of those polled now consider the law a bad idea. It's also a record high. Now, this is a big-time survey. It's a survey of 1,000 adults conducted between December 4th and December 8th, found, and this is really a disturbing part for us as a nation, Mr. President, and it should sadden all America, a sharp erosion since January in many of the attributes they talk about: honesty, leadership ability to handle a crisis, these abilities that you want in a president. You want a president who is perceived by, who, one, is honest, and then, two, is perceived by the public as honest. You want a president who can handle a crisis and is perceived by the public as being able to handle a crisis. But they say that there's been a sharp erosion since last January in many of the attributes: honesty, leadership, ability to handle a crisis that had kept Mr. Obama aloft through the economic and political turmoil of his first term. The poll goes on and asks people about the, and of course this is of 1,000 people across the country, that asks of the, in terms of the impact of the President's health care law, if this is going to have a positive impact on you and your family. Mr. President, fewer than 1 out of 8 people in the country today believe that this health care law will have a positive impact on them and their family. We are changing the entire health care system of the country, and only 1 out of 8 people believe it's actually going to help them. The performance of the President considered to be very bad, significant disapproval, and it is because of the health care law. And people look at this and they say, what does this mean to me? How is this going to affect my life? Well, those are the issues that we talk about here. People are being hit with the incredible increased cost, and they say, well, there are some policies that may be a little bit cheaper, the so-called bronze policies. So the New York Times took a look at that. And again, these are just articles this week, Mr. President. This is Monday, December 9th. On health exchanges, premiums may be low, but other costs can be high. It says, as consumers, and this is by Robert Pear, this Monday. He's a well-known writer, does his research, gets the facts, and he says, as consumers dig into the details. Boy, that's a key phrase, because I believe that so many people that voted for this health care law never looked into the details, didn't know what it meant, didn't know what was going to be in it, because as Nancy Pelosi famously said, first you have to pass it before you get to find out what's in it. Well, Americans are now looking at it, digging into it, and as Robert Pear in the New York Times said, digging into the details, they are finding that the deductibles and other out-of-pocket costs are often much higher than what is typical in employer-sponsored health plans. So what they actually have to pay out of their pocket is much higher than in employer-sponsored health plans. Well, people really care about what they have to pay personally for things. Same day, Wall Street Journal, Monday, December 9th, page 1, deductibles fuel new worries of health law sticker shock. Same information that we've seen there in the New York Times. It says the average individual deductible, the average individual deductible for what is called the bronze plan on the exchange plan I was talking about a little earlier, which is the lowest priced coverage, average deductible is $5,081 a year, according to a new report on the insurance offerings in 34 of the 36 states that rely on the federally, the Washington-run online marketplace. Well, that's 42% higher than the average deductible just last year. on plans that were purchased. This is before the federal law took place. Deductibles fuel new worries of health law sticker shock. Now, I've heard the President say, well, that's because the states that have done it have done really well. It's astonishing. You just kind of turn to the second part of this article. It says, turn to page A6, and there's deductibles fuel new worries of sticker shock. But then what about one of the states that's doing their own plan? The headline even above that, health site snafus plague Maryland. Health site snafus plague Maryland, a state that's decided to do their own website. Maryland is struggling to fix its troubled health insurance website. This is again Monday, more than 2 months after it opened, showing how technology woes are affecting more than just the federal system. And yet we see it's not just the website. People are hitting with one article about the bad website, the next article about higher co-pays and deductibles. Interesting, the official, it says, in charge of Maryland's insurance marketplace resigned after criticism of her decision to take a vacation in the Cayman Islands during Thanksgiving week. New statistics released Friday showed just a trickle of customers, just a trickle, Mr. President, of customers signing up for private coverage in the state. It's interesting that states are having problems and the federal government is having problems. And, people wanted to keep their insurance. They wanted to keep their insurance. They like their insurance. I talked to a woman, a rancher in Wyoming. I talked to her at the Farm Bureau meeting. She lost her insurance. Her insurance worked really well for her and for her family, but she lost it because it didn't meet President Obama's criteria of the 10 different standards that had to be met. Well, and she knows me. She said, Doc, and she called me Doc because I'm the doctor in Wyoming. She said, it's interesting that the reason they lost their insurance was because it didn't include maternity coverage. And she said, Doc, I've had a hysterectomy. I don't need maternity coverage. She said, I know I don't need maternity coverage, but apparently President Obama believes she needs a maternity coverage. The Democrats in the Senate believe she needs maternity coverage. So the question for America is, who knows better what you need for you and your family? Who is the best judge for you and your family? Is it the government or the Democrats who believe they know better than you do? Or the freedom-loving Americans who believe they can make their own decisions about their lives and their families and what insurance they want or not want? People wanted to keep their insurance. They weren't allowed to, but the President said that they could. The President time and time again said that people could keep their insurance if they like their insurance. And I think that's one of the major reasons that the President's credibility has dropped. As a matter of fact, there's a nonpartisan fact checker that year after year called PolitiFact, and each year they go through lots of comments and lots of statements that are made, and they came out last night with their lie of the year. They do this every year. The lie of the year. And the lie of the year that came out from PolitiFact last night for the year 2013 was, if you like your health care plan, you can keep it. And we all know who said it, the President of the United States. They go on to say, he didn't just say it once. They say, we counted dozens of times that President Barack Obama said that if people liked their health plans, they can keep it. They go on to say that it was a catchy political pitch and a chance to calm nerves about his dramatic and complicated plan to bring historic change to America's health insurance system. They quote, if you like your health plan, you can keep it, President Barack Obama said many times. But the promise, they say, was impossible to keep. So this fall, as cancellation letters were going out to approximately, they say, 4 million Americans, the public realized that the President's breezy assurances were wrong, and therefore they've given it the lie of the year. So people saw this coming. Republicans saw this coming. My colleague from Wyoming, Senator Mike Enzi, saw this coming. And that's why he came to the floor years ago and said people are going to lose their coverage. People are going to lose it. He brought a resolution to the floor because he actually reads the Federal Register, Senator Enzi does, and he saw the regulations that came out. And he came to this floor with legislation to say, wait a second, if you really believe that people can keep their coverage, you got to adopt this piece of legislation so people really can keep their coverage. And yet we saw Republicans vote with Senator Enzi saying, yeah, let people keep their coverage. We saw Democrats say, forget it, Senator Enzi. We don't believe you're right. Well, the president was wrong. Senator Enzi was right. There was a letter to the editor in the Powell Tribune in Powell, Wyoming, with the headline, Enzi saw ACA impacts beforehand, shows the value of Senator Enzi. Dear editor, it says, Fox News had a very interesting and informative program Tuesday evening, November 6th, on the Kelly Files with Megyn Kelly. They said, as anyone who watches Fox News knows, they are covering the beginning effects of the Affordable Care Act, also known as Obamacare, as it is being implemented. They say Megyn Kelly began her program stating she had a special guest who had predicted 3.5 years ago almost exactly what will happen when the Obamacare law goes into effect this October. Her special guest was our own Wyoming senior senator, Mike Enzi, and he had made his predictions in a speech on the Senate floor, right from that desk, right over there, 3.5 years ago. He was then called a fearmonger, called by the Democrats a fearmonger and a radical right-winger. Senator Enzi was probably one of a very few elected officials who had actually read the bill. Senator Enzi reads all the bills, understands the bills, understands the implications, and then he goes and reads the Federal Register, knows what's in them, and brings to the floor thoughtful pieces of legislation to actually make things better for the American people, not things worse. And now what we're seeing is people can't keep their insurance, they're losing their insurance, losing their doctor, and losing their hospitals. It's interesting in terms of being able to not even keep your doctor, not being able to keep go to the hospital that you prefer to. And I'd like to just talk for a few seconds, Mr. President, about the doctor-patient relationship and why when the President says if you like your doctor, you can keep your doctor, period, that actually caused comfort for people. But again, that's another broken promise, not necessarily ranked by PolitiFact to the level of if you like your coverage, you can keep your coverage, because millions of people have gotten the letters. But next year, we're going to see more and more people who are not going to be able to keep their doctor. And as a doctor, I wrote an article that appeared on Wednesday of this week in Investors Business Daily called Obamacare Disrupts the Delegate Relationship Between Patient and Doctor. And I'd just like to share parts of it with you now, Mr. President, specifically because this past weekend on one of the Sunday talk shows, Rahm Emanuel's brother, Ezekiel Emanuel, who was one of the architects of the President's health care law, written behind closed doors right out at the end of the Senate. He was on one of the talk shows responding to a question about if you like the President's comments about if you like your doctor, you can keep your doctor. And can you really keep your doctor? Well, what I wrote in this column December 11th was a central architect of the President's health care law admitted this week that the often repeated promise that if you like your doctor, you can keep your doctor simply isn't true. Instead, Dr. Ezekiel Emanuel explained that if you like your doctor, you will simply need to pay more to keep your doctor. As a physician, I know firsthand how this will hurt many Americans. Mr. President, I write how families look to doctors as trusted friends, as confidants, and as counselors, and turn to them for advice in making life and death decisions. In Wyoming, patients have included me in graduations, in weddings, and asked me to serve as pallbearer at funerals. They've asked me to pray with them, to referee family disputes, and to provide reassurance when a doctor that they didn't know was called in to consult. Norman Rockwell's painting, Doctor and Doll, tells the story. A little girl holds up her doll as the trusted family doctor listens to it with his stethoscope. The caring, compassionate physician takes the time to reassure a concerned little girl. Mr. President, I write the doctor-patient relationship is a very special bond. It requires faith and trust for a patient to allow me to cut into their body, to remove a tumor, to replace a worn-out joint, to fix a broken bone, to repair a torn ligament, and above all else, to do no harm. Now, the President knew of that special relationship between people and their doctors. That's why, when he was trying to gain support for the health care law, he made a clear and simple promise to the American people. The President said, if you like your doctor, you can keep your doctor, period. Now people all across the country are finding out that they can't keep their doctor. The same law that has caused millions of Americans to lose the health insurance that worked for them is now causing them to lose their doctor. People who are shopping for insurance on government exchanges are being forced to purchase insurance for things they don't want, they don't need, and they will never use. To keep costs down, many of these policies limit the doctors and the hospitals that patients can use. Some of the nation's premier hospitals, including the Mayo Clinic and Cedars-Sinai Medical Center, are excluded from many insurance exchanges in their networks. Some of the best children's hospitals in the country are also excluded from the exchanges. This means a child with cancer may lose access to his or her doctor and the specialty hospital. Why? Because of the law. In New Hampshire, 10 of the state's 26 hospitals are excluded from the only carrier that offers insurance in the exchange. The head of the medical staff at one of the excluded hospitals in New Hampshire has learned that her plan does not even let her, the chief of staff of the hospital, seek treatment at her own hospital. Now, this situation can be equally bad for seniors on Medicare. Thousands of doctors caring for seniors on Medicare Advantage have been dropped from their networks. Those Medicare patients are now going to be challenged to finding a new doctor to take care of them. The President's health care law is making it harder for doctors as well as for patients. Doctors know that their patients, they know their health history, they know their families, they know their lives, and doctors value the personal relationship as much as the patient does. Now, that's why people become doctors in the first place, to take care of their patients. Even if someone is able to keep their doctor, they won't necessarily be able to spend as much time with them as they might like to. That's because nearly two-thirds of doctors expect to have to spend more time on paperwork under the requirements of the law. Now, this isn't at all what the President promised the American people. People all across America put their faith and their trust in Barack Obama when they elected him president. It's the same kind of faith and trust that they have in their own doctor. And I will tell you, Mr. President, when patients lose trust in their doctor, as citizens are now losing faith in their president, it's extremely difficult to regain that trust. So I continue to hear from my patients in Wyoming. They've always had my home phone number. They are anxious. They are angry. They know what they want from the health care reform. They want access to quality, affordable care. It's not what they got with this law. Now many face losing the doctor who has always been there for them. So if President Obama wants to regain the trust of the American people, he'll sit down with Republicans to deliver reforms that will help all Americans and fully protect the doctor-patient relationship. After all, President Obama has his own doctor at the White House, a doctor who's dedicated to the President's care. And I'm sure that the President values his relationship just as much as other Americans value their relationship with their doctor. So, Mr. President, I continue to come to the floor. I see my colleagues that are arriving. I would call to them their attention as they say, well, we have to make the coverage, all these things that they feel they know what's best for American patients. They say we need to provide psychiatric insurance and coverage, and I have voted to provide parity for psychiatric care. But yesterday's New York Times article by Robert Pear, fewer psychiatrists seen taking health insurance. So the insurance that the President is providing to people doesn't actually help them. Maybe make the President feel better, but it's not actually helping people get care. The President has been very confused and used the word coverage when he should have been talking about actually health care for people, providing physicians to take care of them so people could get what they needed in health care reform, the care they need from a doctor they choose at lower cost. Thank you, Mr. President. I yield the floor.
The question occurs on the nomination. Is there a sufficient second? There appears to be, and there is. Clerk will call the roll.
Mr. Alexander, Ms. Ayotte, Ms. Baldwin, Mr. Barrasso, Mr. Baucus, Mr. Begich,
Hey, Marcus. Hey. How you doing?
Mr. Bennett,
Where?
Mr. Blumenthal, Mr. Blunt, Mr. Booker, Mr. Bozeman, Mrs. Boxer, Mr. Brown, Mr. Burr, Ms. Cantwell, Mr. Cardin, Mr. Carper, Mr. Casey, Mr. Chambliss, Mr. Coates, Mr. Coburn, Mr. Cochran,
See you, babe.
Ms. Collins, Mr. Coons, Mr. Corker,
Hey.
Mr. Cornyn, Mr. Crapo, Mr. Cruz, Mr. Donnelly, Mr. Durbin, Mr. Enzi, Mrs. Feinstein, Mrs. Fisher, Mr. Flake, Mr. Franken, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mrs. Hagan, Mr. Harkin, Mr. Hatch, Mr. Heinrich, Ms. Heitkamp, Mr. Heller, Ms. Hirono, Mr. Hoven, Mr. Inhofe, Mr. Isaacson, Mr. Johans, Mr. Johnson of Wisconsin, Mr. Johnson of South Dakota, Mr. Kane, Mr. King, Mr. Kirk, Ms. Klobuchar, Ms. Landrieu, Mr. Leahy, Mr. Lee, Mr. Levin, Mr. Manchin, Mr. Markey, Mr. McCain, Mrs. McCaskill, Mr. McConnell, Mr. Menendez,
Okay.
Mr. Merkley, Ms. Mikulski, Mr. Moran, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Nelson, Mr. Paul, Mr. Portman, Mr. Pryor, Mr. Reed of Rhode Island, Mr. Reed of Nevada, Mr. Risch, Mr. Roberts, Mr. Rockefeller, Mr. Rubio, Mr. Sanders, Mr. Schatz, Mr. Schumer, Mr. Scott, Mr. Sessions, Mrs. Shaheen, Mr. Shelby, Ms. Stabenow, Mr. Tester, Mr. Thune, Mr. Toomey, Mr. Udall of Colorado, Mr. Udall of New Mexico, Mr. Vitter, Mr. Warner, Ms. Warren, Mr. Whitehouse, Mr. Wicker, Mr. Wyden. Voting in the affirmative: Collins, Franken, Harkin, Heitkamp, Isaacson, Klobuchar, Levin, Manchin, Murkowski, Murray, Pryor, Reed of Rhode Island, Reed of Nevada, Sanders, Warren, and Whitehouse. Mr. Merkley, aye. Ms. Cantwell, aye. Mr. Durbin, aye. Senators voting in the negative: Barrasso, Fisher, Johans, and Roberts. Mr. Leahy. Mr. Leahy. Aye. Mr. Grassley. Mr. Grassley. Aye. Mr. Baucus. Mr. Baucus. Aye. Mr. Cardin. Mr. Cardin. Aye. Mr. Coons. Mr. Coons. Aye. Mr. Paul. Mr. Paul. Aye. Mr. Cornyn. Mr. Cornyn. Aye. Mrs. Feinstein. Mrs. Feinstein. Aye. Mr. Heinrich. Mr. Heinrich. Aye. Mr. Blumenthal. Mr. Blumenthal. Aye. Mr. Donnelly. Mr. Donnelly. Aye. Mr. King. Mr. King. Aye. Mr. Udall. Mr. Udall of Colorado. Aye. Mr. McCain. Mr. McCain. No. Mr. Warner. Mr. Warner. Aye. Mr. Bozeman. Mr. Bozeman. Aye. Mr. Wicker. Mr. Wicker. Aye. Mr. Portman. Mr. Portman. Aye. Ms. Baldwin. Ms. Baldwin. Aye. Mr. Menendez. Mr. Menendez. Aye. Mr. Johnson. Mr. Johnson of Wisconsin. Aye. Mrs. Hagan. Mrs. Hagan. Aye. Mr. Moran. Mr. Moran. Aye. Mr. Heller. Mr. Heller. Aye. Mrs. Shaheen. Mrs. Shaheen. Aye. Mr. Kane. Mr. Kane. Aye. Mr. Casey. Mr. Casey. Aye. Mr. Bennett. Mr. Bennett. Aye. Mr. Wyden. Mr. Wyden. Aye. Mr. Lee. Mr. Lee. Aye. Mr. Vitter. Mr. Vitter. No. Mr. Nelson. Mr. Nelson. Aye. Mr. Tester. Mr. Tester. Aye. Mr. Chambliss. Mr. Chambliss. Aye. Mr. Scott. Mr. Scott. Aye. Mrs. Boxer. Mrs. Boxer. Aye. Mr. Risch. Mr. Risch. No. Mrs. McCaskill. Mrs. McCaskill. Aye. Mr. Barrasso. Mr. Barrasso. Aye. Mr. Enzi. Mr. Enzi. Aye. Mrs. Gillibrand. Mrs. Gillibrand. Aye. Ms. Stabenow. Ms. Stabenow. Aye. Mr. Udall. Mr. Udall of New Mexico. Aye. Ms. Ayotte. Ms. Ayotte. Aye. Mr. Toomey. Mr. Toomey. Aye. Mr. Burr. Mr. Burr. Aye. Mr. Murphy. Mr. Murphy. Aye. Ms. Landrieu. Ms. Landrieu. Aye. Mr. Rubio. Mr. Rubio. Aye. Mr. Flake. Mr. Flake. Aye. Mr. Shelby. Mr. Shelby. Aye. Ms. Hirono. Ms. Hirono. Aye. Mr. McConnell. Mr. McConnell. Aye. Mr. Markey. Mr. Markey. Aye. Mr. Brown. Mr. Brown. Aye. Mr. Thune. Mr. Thune. Aye. Mr. Cochran. Mr. Cochran. Aye. Mr. Carper. Mr. Carper. Aye. Mr. Hoven. Mr. Hoven. Aye. Mr. Cruz. Mr. Cruz. Aye. Mr. Schumer. Mr. Schumer. Aye. Mr. Begich. Mr. Begich. Aye. Mr. Sessions. Mr. Sessions. No. Mr. Sessions. Mr. Sessions. Aye.
do I hit the... Are there any senators that wish to vote or change their vote? If not, there are 79 yeas and 6 nays, and the nomination is confirmed. Clerk will now report the motion to invoke cloture.
Cloture motion. We, the undersigned senators, in accordance with...
Senate will come to order.
Cloture motion. We, the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, hereby move to bring to a close the debate on the nomination of Heather Ann Higginbottom of the District of Columbia to be Deputy Secretary of State for Management and Resources, signed by 19 senators.
Pursuant to Rule 22, the chair now directs the clerk to call the roll to ascertain the presence of a quorum.
Mr. Alexander, Ms. Ayotte, Ms. Baldwin, Mr. Barrasso, Mr. Baucus, Mr. Beckidge, Mr. Bennett, Mr. Blumenthal, Mr. Blunt, Mr. Booker, Mr. Bozeman, Mrs. Boxer, Mr. Brown, Mr. Burr, Ms. Cantwell, Mr. Cardin, Mr. Carper, Mr. Casey, Mr. Chambliss, Mr. Coates, Mr. Coburn, Mr. Cochran, Ms. Collins, Mr. Coons, Mr. Corker, Mr. Cornyn, Mr. Crapo, Mr. Cruz, Mr. Donnelly, Mr. Durbin, Mr. Enzi, Mrs. Feinstein, Mrs. Fisher, Mr. Flake, Mr. Franken, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mrs. Hagan, Mr. Harkin, Mr. Hatch, Mr. Heinrich, Ms. Heitkamp, Mr. Heller, Ms. Hirono, Mr. Hoven, Mr. Inhofe, Mr. Isaacson, Mr. Johans, Mr. Johnson, Wisconsin, Mr. Johnson, South Dakota, Mr. Kane, Mr. King, Mr. Kirk, Ms. Klobuchar, Ms. Landrieu, Mr. Leahy, Mr. Lee, Mr. Levin, Mr. Manchin, Mr. Markey, Mr. McCain, Mrs. McCaskill, Mr. McConnell, Mr. Menendez, Mr. Merkley, Ms. Mikulski, Mr. Moran, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Nelson, Mr. Paul, Mr. Portman, Mr. Pryor, Mr. Reed of Rhode Island, Mr. Reed of Nevada, Mr. Risch, Mr. Roberts, Mr. Rockefeller, Mr. Rubio, Mr. Sanders, Mr. Schatz, Mr. Schumer, Mr. Scott, Mr. Sessions, Mrs. Shaheen, Mr. Shelby, Ms. Stabenow, Mr. Tester, Mr. Thune, Mr. Toomey, Mr. Udall of Colorado, Mr. Udall of New Mexico, Mr. Vitter, Mr. Warner, Ms. Warren, Mr. Whitehouse, Mr. Wicker, Mr. Wyden. A quorum is present.
A quorum is present, and the question now is, Majority Leader.
Could we have order? I have an announcement I'd like people to hear.
The Senate will come to order. Majority Leader.
Thank you, Mr. President. I realize everyone is tired, anxious. Some are a little concerned about everything. Mr. President, I have had during especially late last night and early this morning, conversations with Republicans and Democrats as to what we should do this weekend. Now, the next set of votes will come shortly before noon today. And then we'll have another set of votes this afternoon. Absent consent, the Senate will vote late Saturday, probably about 10:30 or thereabouts, on confirmation of Jay Johnson to be Secretary of Homeland Security. The Senate's already received the budget bill from the House. We expect momentarily to receive the defense bill from the House. So I would like the Senate to process these important bills as quickly as possible. So I plan to move to proceed to these bills as soon as we can. And that would be as soon as we handle the pending nominations that are now before this body. Thereafter, there are certain things that we need to do before the Christmas break. That is, we need to do those two important bills, the budget and defense. We have to do the chair of the Federal Reserve System. There's an Undersecretary of State that is very, very urgent, according to John Kerry. We have a Deputy Secretary of Homeland Security, Undersecretary of the Department of Interior, the head of the Internal Revenue Service, and the remaining judge on the D.C. Circuit. There's been a request from everybody, I shouldn't say that, lots and lots of people to do other things. But we're limited as to time what we can do before next weekend. There are some other nominations that we're happy to discuss with individual senators. So it would be my suggestion that we'll go ahead and do this vote during this vote prior to the next series of votes. I'll meet with the Republican leader to see if there's a way that we can give relief, especially to the staff over the weekend. We have these people worked extremely hard, and I haven't heard a complaint from a single one of them, quite frankly. But I went up last evening and visited the court reporters. We have 16 court reporters. And up on the 4th floor, they have been sharing for a little respite. They have 2 beds that they're sharing, taking naps or trying to at least lay down and rest a little bit. They've worked extremely hard. You know, they work in 15-minute shifts, and they've been doing that for days now. So if we can work that out, I'd be happy to do that. My goal would be to wind up at the same place on Monday in the evening as we would wind up if we did all this stuff over the weekend. So I'm happy to be as cooperative as possible. Christmas is on its way, and there are certain things that we need to have done. And there are lots of other things that we need to do, but we're probably not going to be able to do those. But I have laid out for everyone a broad scope of the schedule. I'll meet with my friend, the Republican leader, and see if there's some way we can do this. Otherwise, we'll just proceed on. The good news is that following up the vote this afternoon, we wouldn't have anything until tomorrow night under the schedules that's now listed.
What number are we at? Good, you're good. Okay, now a quorum is present. The question is it the sense of the Senate that debate on the nomination of Heather Ann Higginbottom of the District of Columbia to be Deputy Secretary of State for Management and Resources shall be brought to a close? The yeas and nays are mandatory under the rule, and the clerk will call the roll.
Mr. Alexander. Ms. Ayotte. Ms. Baldwin. Okay. Mr. Baucus, Mr. Beckidge, Mr. Bennett, Mr. Blumenthal, Mr. Blunt, Mr. Booker, Mr. Bozeman, Mrs. Boxer, Mr. Brown, Mr. Burr, Ms. Cantwell, Mr. Cardin, Mr. Carper, Mr. Casey, Mr. Chambliss. Yes, sir. Mr. Coates, Mr. Coburn. Marky, I got you. Mr. Cochran, Ms. Collins, Mr. Coons, Mr. Corker, Mr. Cornyn, Mr. Crapo, Mr. Cruz, Mr. Donnelly, Mr. Durbin, Mr. Enzi, Mrs. Feinstein, Mrs. Fisher, Mr. Flake, Mr. Franken. Mrs. Gillibrand. Mr. Graham, Mr. Grassley, Mrs. Hagan, Mr. Harkin, Mr. Hatch. Mr. Heinrich, Ms. Heitkamp, Mr. Heller, Ms. Hirono, Mr. Hoven, Mr. Inhofe, Mr. Isaacson, Mr. Johans, Mr. Johnson of Wisconsin. Mr. Johnson of South Dakota. Mr. Kane. Right there. Mr. King. Yeah, I see him. But he didn't. Mr. Kirk, Ms. Klobuchar, Ms. Landrieu, Mr. Leahy, Mr. Lee, Mr. Levin. Aye. Yep. Mr. Manchin, Mr. Markey, Mr. McCain, Mrs. McCaskill, Mr. McConnell, Mr. Menendez, Mr. Merkley, Ms. Mikulski, Mr. Moran, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Nelson, Mr. Paul, Mr. Portman, Mr. Pryor, Mr. Reed of Rhode Island, Mr. Reed of Nevada, Mr. Risch, Mr. Roberts, Mr. Rockefeller, Mr. Rubio, Mr. Sanders, Mr. Schatz, Mr. Schumer, Mr. Scott, Mr. Sessions, Mrs. Shaheen, Mr. Shelby, Ms. Stabenow, Mr. Tester, Mr. Thune, Mr. Toomey, Mr. Udall of Colorado, Mr. Udall of New Mexico, Mr. Vitter, Mr. Warner, Ms. Warren, Mr. Whitehouse, Mr. Wicker, Mr. Wyden. Senators voting in the affirmative: Baldwin, Baucus, Beckich, Bennett, Blumenthal, Booker, Boxer, Brown, Cantwell, Cardin, Carper, Casey, Collins, Donley, Durbin, Feinstein, Branken, Gillibrand, Hagan, Harkin, Heinrich, Heitkamp, Hirono, King, Klobuchar, Landrieu, Leahy, Levin, Manchin, Markey, McCaskill, Menendez, Murkowski, Murphy, Murray, Pryor, Reed of Rhode Island, Reed of Nevada, Sanders, Schumer, Shaheen, Stabenow, Tester, Udall of Colorado, Udall of New Mexico, Warner, Warren, Whitehouse, and Wyden. Senators voting in the negative: Ayotte, Barrasso, Bozeman, Chambliss, Coates, Cochran, Cruz, Enzi, Fisher, Flake, Heller, Isaacson, Johans, Johnson of Wisconsin, Lee, McCain, McConnell, Moran, Paul, Portman, Risch, Roberts, Rubio, Scott, Sessions, Shelby, Toomey, and Vitter. Mr. Grassley, no. Mr. Coons, aye. Mr. Burr, no. Mr. Hoeven, no. Mr. Wicker, no. Mr. Thune, no. Yeah, voted. Mr. Cornyn, no.